Robin. How are you today?
Hi, Dr. Herman. Fine, thank you.
Good. Let's start off with what brought you here. What would you like to accomplish?
Well, I just feel like I've been looking just older, just tired, just not refreshed. I've got a lot of lines, wrinkles, just trying a more youthful appearance.
Okay. I'm going to have you look at yourself in the mirror, and we'll kind of address each issue and talk about what I think would work well.
Okay.
Okay, so starting with the lines in your forehead, when I stretch these lines, at this point they're pretty faint. When I stretch them, I can still see a little line remaining, which tells me that there may be some level of permanence to the line. If I can stretch it and it's not completely erased, but it's going to lighten up a whole lot, and we may be able to make it go away completely. Same with these lines. I mean, actually, looking at that, these are going to go away completely. So that's going to be good. And that's going to be with the Botox. And also we give you a little bit of a brow lift, which helps bring up the upper lid and arch your eyebrow. Really nice.
Great.
Yeah. We also use the Botox right in the outer part of your eye. People call it the crow's feet. But I never like to use that word. Just, you know, the outer eye lines right there. And those will lighten up. Those will go away completely on you too. Okay, so now going down to the lines that are under your eyes, these will get with two different things. One, peels and laser can help lighten up these very fine lines. We don't use Botox in this area of the face. And we also really don't use Botox a whole lot in the lower half of the face. There's a little use for Botox right in here to help with the kissy lips, right. Yeah. But for the most part, we don't use Botox in the lower half of the face. So really, to lighten up these lines, it's going to be a combination of, what I recommend is a combination of filler, which will, as we age, we tend to lose the fat pads under our eyes and the fat pads in our cheeks. That's normal aging process. As we lose that fullness, the skin has nowhere to go, so it goes right here. So it's not necessarily that our skin is falling or becoming more lax. It's actually that what's underneath it is no longer there. So if we restore the plumpness of youthful cheeks, the comes up. The lines and the tissue right here are back to where they should be. It helps actually get rid of some of the lines under the eyes and in the nasolabial folds right here. So, and creates overall a look of more youthfulness. And then as we restore the fat in the outer parts of the cheeks, it brings up, you know, that skin has nowhere to go but out here. So sometimes, I mean, yours is very, very mild, but you know, the younger people will have almost like a complete straight angle of their jaw. And as we age, we get a little dimpling in there. And you're your own worst critic. Like I say, yours is pretty mild, but as we, you know, if we restore, that will come up and make that angle right here nice and straight.
Great.
Yeah. Okay, so what I see with your mouth, and you might want to look again, is, first of all, and you probably noticed this, the lines right in the corners of your mouth. That we can help with filler, and also laser can help take away these lines. The lines sort of, well, they call them smoker's lines even when people are not smokers. We just get those lines from talking, from eating and drinking. It's just, it's normal. So a little Botox will help. But then in addition to that, I think you would look good with some filler on the outer portions of your lips, which helps to stretch this and make those lines go away. Good. And then the final thing that I would see are some of these lines right in here. And again, I think a really good peel, like a Jesner's peel, will help lighten those up. And laser can, you know, we can also do an ablative laser to help with this too. Then kind of just moving down your neck. Like I say, I think you really have, you know, really good, you have very little extra tissue on your neck. But the one thing I can see is some sort of crepiness, we would call that, right there.
I've been noticing a lot within the last, like, probably year and a half. It
just came along. Yeah, and that's something that the accent can take away. What the accent does is it's not painful. There's no downtime. It's a series of treatments. Each treatment breaks up the collagen, and when the collagen remodels, it remodels firmer and tighter. And so it brings the collagen bundles closer together. It's FDA approved for fine lines and skin laxity. So I think that would sort of complement all of this very well, usually for the lower half of your face and neck. All of the things we've just talked about will help restore volume and get rid of a lot of the fine lines and wrinkles and skin laxity. There are several things that make a youthful appearance. It's not that there's magic to one by itself. The other thing we need to focus on is the quality of your skin, pore size, skin discoloration from sun damage, and small veins and redness from things like rosacea, as well as fine lines. And so for you, I think that a combination of probably peels, which will let the esthetician determine which one would be best for you, and microdermabrasion to get rid of some of the pigment and some of the fine lines. And then we'll probably be doing some laser treatments to get rid of any of the sun damage that is left afterwards. Like I can see right in here, you know, you've got some brown, and that can easily be lifted with laser. Your pores are pretty good, but you do have, you know, some larger pores right in here, and that is something laser facial will treat very well. Mm-hmm. And then also some of the redness right in here. Mm-hmm. You know, you don't want to have your face be one color and your chest be another.
That was another concern
yeah,
of mine too. Is
exactly. We don't want to only
restored and then my
no.
chest is not.
Yeah, we're definitely going to be doing the accent on your neck to help that skin quality. Mm-hmm. And when we do a laser facial, we'll include the décolletage and neck region so that you have sort of a uniform look. Perfect. All right. So the next step is going to be we're going to have Ileana talk to you, take a look at what peels, or whether she thinks peels versus microdermabrasion would be best for the quality of your skin.
Okay, great.
All right.
Thank you.
Very good.